Welcome to Meet Our Researcher series. Today we got Dr. Arandi Hevavasam. Arandi is a postdoctoral research fellow from ANZDATA, and she completed a PhD in maternal and childhood, particularly looking at short-term and long-term outcomes for preterm born babies. How are you doing today, Arandi?
I'm very well, thank you. It's great to be here.
What are you currently working at ANZDATA?
Currently working on a number of parenthood research projects where we are looking to help both men and women with kidney disease achieve their parenthood goals.
Okay.
Yeah.
So what is the importance of your research?
Yes, we know that women with kidney disease have complex pregnancies and very clinically challenging pregnancies. But what we don't know is what are some of the factors that might be driving these pregnancy outcomes.
Yeah. Okay, I know it's a bit of a selfish question. Have you looked at any data for men like me who had a transplant and planning to start a family? For example, what are the outcomes for the babies fathered by men like me?
That's a great question, Sham. Yes, at the ANZDATA registry, we have looked at the fatherhood outcomes in men receiving kidney replacement therapy. And what we have found is that generally outcomes were good for babies fathered by men with kidney disease, particularly in kidney transplantation or with dialysis. Or even the exposure to immunosuppressive medications. But what we don't have a good understanding is the longer term outcomes for babies fathered by men with kidney disease.
Yeah, that makes sense. Okay, how are you going to answer all these research questions?
So to find a bit more about some of these factors which might be driving these pregnancy outcomes in women with kidney disease, and to look at the impact of kidney disease for babies fathered by men with kidney disease, we are currently conducting a data linkage study.
Okay, yeah. So, Arandi, where are you up to on this project?
Yeah, so we have linked the two data sets now, and we have identified a birth cohort of 3 million babies.
Wow.
Yes, from 4 Australian states, so that's Australian Capital Territory, South Australia, Western Australia and New South Wales, and the data is from 1991 to 2013.
Wow.
And this includes babies born to mothers with end-stage kidney disease, babies born to mothers with chronic kidney disease, and babies born to mothers without kidney.
So that's the general population?
Yes, that's correct.
Yeah.
And this actually, the 3 million birth cohort represent about 50% of all births in Australia.
Okay.
Yeah. So we have looked at the birth rates, and now the next step is to do further analysis to look at the pregnancy outcomes and the outcomes for the babies.
Okay. Are there any consumers involved in this project?
Absolutely. So we are working with a group of 6 women.
Wow.
So it's a national consumer advisory group.
Yeah.
And these women from various stages of kidney disease, various stages of their pregnancy journey, and they're really helping us set research priorities, our research questions, and helping us with the data collection tool, and as well as translating our research findings back into the community.
That's really good. You have a lot of consumer involvement in your project.
Yes.
So, Arandi, I know that some women with kidney disease may face emotional, social and ethical challenges when planning a pregnancy. In your research, how you are going to address these issues?
We are currently doing a survey to find out a bit more about women's thoughts and experiences with receiving pregnancy information.
Yeah.
So any women with kidney disease and their partners can really help us with this survey. Whether you are thinking about pregnancy at the moment, or whether you are currently pregnant, or whether you have had a pregnancy in the past, we would really like to hear from you.
That's good. I would like to encourage everyone to visit ANZDATA website to complete this survey that will help Arandi to address these issues. Okay, Arandi, thanks for explaining this. Now tell me, what is your end goal of this project? Like, say for example, down the line, say 5 years or 10 years, how your project is going to help women with kidney disease to plan the pregnancy?
We are hoping to develop a toolkit for patients, their partners and their family, as well as doctors and healthcare professionals. And this toolkit will have educational resources like pamphlets, decision aid tools and educational forums and many others to help both patients and doctors with decision making and navigating pregnancy with kidney disease.
So when you say decision aid tools, that means, say for example, if a woman go to consult her nephrologist, and this tool will help them to predict the risk of having a preterm birth. Is that what you think?
Absolutely correct, yes.
Yep, okay. So thanks for explaining your project to our consumers, Arandi.
Thanks for having me, Sham.
If you need to find more information about Arandi's work, please visit ANZDATA website at www.anzdata.org.au. Thank you.
Thank you.